Good afternoon, everyone. I'm Neera Tandon, the President and CEO of the Center for American Progress, and I'm really thrilled to welcome all of you to this event today. Community colleges are the cornerstones of our country's higher education system. They educate a third of all college students, and yet they receive less than half the funding they get per student of public research universities. They educate a large number of Black, Latinx, and Native American students, as well as low-income students, and those balancing school with jobs and raising families. And yet, these are the colleges that were shortchanged when it came to the distribution of emergency aid in the wake of the CARES Act. Because they largely serve students of color, so students who have been harder hit by the pandemic, community colleges have been contending with the added trauma that their students are experiencing. And that trauma has also been exacerbated by the recent murders of Black people by police, including those of George Floyd, Breonna Taylor, as well as that of Los Angeles Trade Technical College student Andres Guardado, who was killed by police in June. And when it comes to the pandemic, community colleges haven't received the kind of public attention that four-year colleges are getting right now as they consider how to reopen. And perhaps that's because community colleges have been so much more clear-eyed about the dangers related to reopening campuses to thousands of students. So we're here today to shift the spotlight to these colleges and these communities. This is a vital center and it needs much more attention. At CAP, we believe that this country can emerge from this moment of crisis a more racially and economically just society. But that's only if we invest in supporting the people and institutions that have been most harmed. That is exactly why we have to put community colleges at the forefront, not at the back, but at the forefront of our discussion of public universities, of college education writ large. So today we have the opportunity to learn from community college leaders about the work they're doing to uphold equity in the face of enormous adversity and what support they need at this time. I'm thrilled to have with us today the leader of the largest community college system in the country, Chancellor Oakley, the president of a Midwestern college known for its student success and hard work, Dr. Proctor, and the head of a tribal college that has been at the epicenter of one of the worst coronavirus outbreaks in the country, Dr. Russell. I want to welcome all of you and thank you for being our panelists today, and really thank you for your tremendous leadership in this vital moment for our country. I'll now turn things over to Marcella Bombardieri, an Associate Director of Higher Education here at CAP, who will be moderating today's discussion. Marcella?
Thank you so much, Neera. I welcome everyone. Thank you so much for joining us. Good afternoon to those of us in the East, and good morning to those of you joining from the West. One nice upside of our strange virtual world is that we have people joining us from all corners of the US, which is really great. Wanted to mention a couple of quick housekeeping notes before we get to our fantastic panel. First, please know that live captioning is available at americanprogress.org/live captioning. And if you have questions for our panel, which we hope that you will, you can submit them using the question tab on the side of your screen or on social media using #CommunityCollegesLead. And we promise to leave time for them towards the end of our hour. And to make some super quick introductions so we can jump right into our conversation, I am joined by Chancellor Eloy Ortiz Oakley, who oversees the 115 California community colleges, which serve 2.1 million students. Dr. Avis Proctor, president of Harper College in Palatine, Oregon, Illinois. I don't know where Oregon came from, I apologize. A large community college serving 23,000 students a year in the northwest suburbs of Chicago. And Dr. Charles Monty Russell, president of Diné College, the first tribally controlled college in the United States, which serves a predominantly Navajo population of 2,000 students a year across the 27,000 square miles of the Navajo Nation, which spans Arizona, New Mexico, and Utah. And one quick note before we get started, I'm an incurable note taker with old-fashioned pen and paper. So if you see me looking down, I've got my trusty legal pad here. So Chancellor Oakley, Dr. Proctor, Dr. Russell, welcome. Many of your students are Latinx, Native American, or Black and have been disproportionately burdened by the pandemic, as well as by the instances of racial hatred and violence that have shaken our country in the last few months. And many of your students have experienced real trauma in recent months. So I want to ask each of you to talk about how you're attempting to serve the students who are most affected by these crises. And Chancellor Oakley, would you like to get us started?
Sure. So I think, as you pointed out, students in community colleges are at the front line of this widespread disaster that we see unfolding in front of us. First of all, you have the public health crisis. And of course, our colleges serve those communities that are impacted the most by the public health crisis. Our students are primarily low income. We serve large communities of color. These are the communities that have been most impacted by the health crisis, followed by the economic crisis. The huge unemployment that we see directly impacts the students that we serve. And then you follow that with the social unrest, you know, the brutal killings of people of color are impacting emotionally and directly the communities that we serve. And then you pile on top of that a Department of Education or Department of Homeland Security that targets our students. So all these things are weighing down on our students, our faculty, and our staff, and are making it very difficult for them to continue to push forward in this environment. Having said that, we also see enormous resiliency in our students, in our faculty. So in terms of the impact, not only is the impact targeting them directly, but we're also seeing huge hope in the resiliency that they're demonstrating.
Thank you so much. Sorry, getting used to my controls here. And I'm glad you touched on the resiliency. That is a really important point as well. Dr. Proctor, do you want to take that next?
Sure. So I echo what the chancellor said in terms of the layered impact from the public health crisis and economic crisis and social injustices that our communities are, grappling with. And so to get to the heart of the matter, we wanted to know how our students were impacted. And so we surveyed them so we can get real-time feedback as to how we can support our students. And prior to the pandemic hitting, we were already working on equity as an important focus for the college. And so we established a vice president for diversity, equity, and inclusion. We're equipping her with the tools necessary to focus on this and really make it a part of the fabric of our institution, and use that lens as we make decisions on supporting our students and equipping our employees to actually use that lens as well in their everyday practices. We put in place technology, equity and technology access. So we had laptop Chromebook loaners that we established for students. So when the pandemic hit, having had that in place already, we were ready at least to continue that support of our students. And the Wi-Fi access was another challenge that we had to find ways to help students with that. And then there are other things that we put in place in terms of student success initiatives. Students who are close to finishing their programs and needed financial support for tuition. So we had finish line micro grants to help students get to that finish line, and many other ways of supporting students. And then we had a basic needs task force that was already in play. And so a lot of their recommendations, they were able to come forth and bring proposals that directly impact students to help remove barriers. And that really has emerged as a theme for our strategic plan that we're launching this fall. And that's one of the stated goals, that we're going to identify and remove barriers to students' success. So this crisis is really has a spotlight on all the disparities and inequities that we need to focus on. And community colleges are more than ready and willing to figure out solutions to advance our communities.
Thank you, Dr. Proctor. Dr. Russell.
Yeah, I agree with everything that's been said. And I think the other thing that this pandemic and this situation has forced us to do is to also redefine what community means. I mean, we have, what is a community college? What is a community? Is it just the students? Is it the people around you? If we look at it from a tribal perspective, is it a tribe or is it beyond the tribe and is it a region? And I think by having those types of discussions, I think it also addresses how then you are going to address the concerns and the challenges that students / community are dealing with. When you talk about equity in Indian country, it's like, where do you start, right? I mean, we're so far behind in so many ways. And I think one of the challenges that we have is how do you try to address all these myriad of injustices? And what we've been doing, I mean, not we, but as a country, is just playing on the edges. You're not going to make any great change if you just play on the edges. It'll make people feel better. They think they're doing something, but it's not going to move the needle. And I think we need to do something that really addresses and moving the needle as we at the same time are trying to address the needs of students. I mean, we can have a plan for a group of students, but then you get an email and that group, now you have another outlier. And then you realize that that outlier is actually the norm. And then the outlier, you just keep approaching the outlier and you realize that's normal now. So we have students that have to, hike up a hill, half a mile just to get a signal to be able to take a class. That's, where do you even begin to have that conversation of equity? We talk about attendance as if that's, making college accessible as the right. But if you have to hike up a hill, go through a canyon, sit on the edge of a mesa just to get a signal, we're having a very different conversation about equity from different perspectives. And I think it's important that we recognize that there's uniqueness in all of our communities that address equity in ways that are personal to us, but also in ways that address the community at large. And so I think some of the things that we've been really focused on is, the mental health needs of our students. That's something that we really are trying to address. We're not doing a good job. I'll be honest. I mean, nobody's doing a good job. And if they say they are, they're lying, because the need and the is so great. We don't even know the totality of that need. And yet when we address that within Diné College, we're looking at it from the perspective of how do you infuse our traditional teachings? How do you make sure that our students are learning not just the needs that they have in terms of addressing trauma, but that it's also infused with culture. And so that again goes back to what I said earlier about redefining what community means and having an approach that reflects of that community.
Thank you so much, all of you, for touching on, so much of what your students are facing right now. That I think that was a really good way to just get our listeners grounded in what you're dealing with right now. And I think another thing that people are just very curious about is the details of how you're planning for the fall when there is so much complexity and things are changing so rapidly. And all of your institutions are planning to hold classes primarily online, and there may be exceptions for labs, whether it's for nurses or biology students. And I am wondering how you decided what to do and how you weighed the safety issues against the access issues, especially when you have students who don't have broadband, don't even have computers, have so many challenges. And also, if you're interested in weighing in on this, I would also be interested to know why you think that community college opening plans have looked so different than what four-year institutions have been talking about for the last few months. And Dr. Proctor, do you want to get us started on that?
Sure. So as you've already mentioned, our fall plan is that our classes will be primarily online. In Illinois, we are aligning our planning to the Restore Illinois framework that the governor has put in place. And so right now we're in phase 4 of the Restore Illinois plan. But in working, first of all, everyone has a different environment that they're working in. So we have 6 unions, and I wanted to be sure that whatever we do, we weren't violating collective bargaining agreements, but we had a partnership that we were using in terms of in collaboration with our union leaders. How are we going to address safety, number one? And that has been core to our messaging and our decision making from day one. How we're going to address safety, and then, of course, how do we fulfill our mission? And so, in the beginning, we worked with the unions and established memorandums of agreement on how we will approach our decisions. They were involved sitting at the table, actually, for example, with our faculty. We have a modalities committee that we established to look at what should we put in place for the fall semester. So faculty were involved every step of the way in terms of the class sizes. Restore Illinois for phase 3 was to have no more than 10 people in a group, and we decided to stay at that level. So our classes that are going to be on campus are 10 or less, maximum 10 in a classroom. Again, even though we're in phase 4 of Restore Illinois, we're actually using the phase 3 implementation, and also trying to be ready if the virus does surge, right? So if we get an uptick in the virus and now we're having to pull back fully remote, it's not going to be disruptive to everyone because we're already at that small class size. And again, learning objectives, making sure our students get exposed to the right learning outcomes that we want them to achieve. So that's what we've done thus far for the fall.
Thank you. Dr. Russell, your students have a lot of issues with access to the internet, as I understand.
Yeah, and I think, one of the things that we did right towards the end of spring and spring semester is we surveyed our students, asking them, and I think we all probably did that. Do you plan to come back? What are your, you had emergency needs in the spring, but what does it look like going forward, to get an idea? And we had a conversation before, we started here, and how fluid these plans are. What we had in June is nothing like what we have right now. In fact, we just are in the process of evaluating whether or not we're going to go all online, and making that determination, because you can make these plans, but then something happens and then you realize those plans don't really mean anything. So we had a situation last week where a food service worker tested positive, and we shut the whole campus down. So if our plan is to shut the whole campus down, that's not a plan, right? So we had to reevaluate these steps that we had in place. So looking at it from the safety of our staff, but also from the students, because right now we don't have anybody on campus in terms of students, and we shut down. So what happens when we have students? So looking at that, I will say this, I think what we've seen in the last couple of weeks is more students who did say they were going to come to face are saying, no, we're going to go online. And students and faculty, we see a surge of, or an increase of number of faculty that are retiring. Our average age, so we have some other, things that are unique to us. Our average age of faculty is 65 years old. So they're already in that high risk category. You also have students that are traveling, 60, 70, 80, 90, 100 miles to come to campus. So to go for one class and come back doesn't make a whole lot of sense. So how do we try to address those needs and addressing that? And then what I had talked about earlier in terms of evaluating the technology. So we've actually had some staff members that have driven around the reservation looking at how many bars do we have here, how many bars do we have there, just to see that if we have these units that we're going to give out to students, that they can actually, be working, that it'll actually be successful to online. So a lot of those little things that make it so, unique to us, I think, is what we're looking at. But I think the big thing, the other thing and the challenge that we have is that we're like right now, I'm in Shiprock, New Mexico at our campus. We have 4 campuses in Arizona. So we have 2 states that we're dealing with. New Mexico, who is very engaged with the colleges, and Arizona, which is very much like you're on your own. And so trying to work that out also has been a challenge in terms of how do we try to maneuver through that, and how do we try to then work together with some of the other partners that we have within higher education.
Thank you. Chancellor Oakley, I'd love to hear your thoughts on this as well. And I'll just also point out that you're a regent of the University of California. So I wonder if you would be willing to address why four-year colleges' plans have looked so different in many cases from community colleges.
Well, I think the difference is in the financial model of how we run our institutions. And I'm not putting a value on that, but certainly a four-year university has a massive amount of infrastructure in the residential portion of their operation. You also have, many of our campuses in the UC are have big athletic programs. Certainly, if you think about UCLA or Berkeley, there is a huge amount of infrastructure there. There's a huge amount of cost. There's a huge amount of revenue that the campuses are losing. So their calculus is different than a community college, which primarily is there just to serve the community, to serve the students. And yes, we have athletic programs and a lot of other infrastructure, but it's a lot easier for community colleges to just focus on the primary mission than a large complex university system. Whether that's a good thing or a bad thing, I think it's a good thing for community colleges because we do what we're supposed to do, which is serve the community. Having said all that, I agree with our guests here that the one thing that we know for sure is that nothing is certain right now. So it's impossible to tell you that we have one bulletproof plan as to how we're going to open up in the fall. That's just craziness right now because the world is crazy right now. So we have to prepare for that. We have to be as flexible as possible. We have to put the priority on the students' needs, and we have to protect the safety of our faculty, staff, and our community. So given all of that uncertainty, the most certain thing that we can do is to communicate to students that we're going to be as remote as possible in order to protect their health and to ensure that we have some certainty. If we're able to open up in-person instruction, great. But the way things are going, if we do open up, the likelihood of us closing back down is pretty likely right now. And the other complexity we have in California is that, we're a huge state. The northern part of California is very different than the southern part. So we're going county by county, working with our local health officials there, and really just trying to do as much as possible within the guidance that Governor Newsom has given us to put a priority on health and safety, to have a priority on the continuity of instruction, and to do everything we can to help our students continue their educational goals. And as has been mentioned, broadband is a huge impediment. It has exposed this horrible scab on our country and our state that we cannot provide broadband access to the majority of low-income Americans right now. And that's something that we're going to have to correct.
Thank you all so much. I want to turn to a few questions now about some of the policy issues that are just really salient right now here in Washington, where Congress is negotiating over what we hope will be another stimulus to support higher education. I think people will be really interested to understand a little bit of how your institutions have dealt with the effects of what's happened over the pandemic, especially with the CARES Act, and then we'll talk a little bit about what is important for you going forward into the next stimulus. And so I wanted to ask you to talk a little bit about the emergency aid that came to students in the CARES Act. And that was a difficult thing for colleges to deal with because it's a limited amount of money. There's a huge amount of need among your students. How did you decide what to do with that aid? And Dr. Proctor, I noticed that Harper College had a standard lump sum of $625, I believe, that all eligible students received. while Dr. Russell, your college gave grants to eligible students that ranged from, I think, about $475 to $700. So I'm curious how you decided how to best use those limited funds. And Dr. Russell, do you want to start that off?
Sure. What we decided, the first thing we decided is that we're giving that money to the students. How, I think we all kind of come to that decision of saying, exactly what that formula looks like. But that also meant that a lot of students were left out. So, we had our student body, and I think roughly about 1,400, and 200 students were left out of it because they did not qualify for the CARES Act. So then we also put together other funds to say every student needs something. So we found other ways to supplement that. So every Genesee College student last semester in the spring received some source of funds. We decided to break it down, whether, full-time got nearly the 700, half-time and below got the 475. And what made it difficult and kind of unique and a challenge for us also is that a lot of our students do not have bank accounts, do not have access to banking. We have one bank, there's only, I think, 4 banks or 5 banks on the reservation. And so that's for a 25,000 square mile reservation. So in terms of having access to that, so we actually had to have them drive up. We had lines of, close to 80 cars, and they would sit out there for 4 hours waiting to get their check. But that's how much they needed it at one time, right? And so we did that at different sites throughout our campuses. But the primary focus was is to get all that money out. And then we found other places that provided us some funds. The American Indian College Fund gave us funding to help us with additional students that we didn't meet. And then we had raised our own internal money and earmarked that. So we had everybody get a scholarship or a grant for the semester. And it went, when we handed these checks out, they were crying, there were tears in their eyes. It was one of the most emotional, experiences I've seen. And they were thanking us, and yet they're the ones that are hiking on top of the hill, going to, get the signal for their classes. And this just allowed them to stay in touch with the college. I remember one email that I received from a student who family had COVID-19, who had to take care of their brother, who was a special needs student. Dealing with him, had to take care of her own class and had to still work 50 miles away just to be able to go to class. And she said, but I'm going to make it. I'm going to be the first to graduate from college. So these little, for us, when we look back, we'll say, well, it's just another grant, but it really kind of allowed us an opportunity and allowed the students an opportunity to continue to achieve their goals going forward. But I think the biggest thing that we looked at is, okay, what do we need to do in terms of other challenges too? It's one thing, if you're dealing with having to travel 100 miles one way for class, that's going to eat up a lot of gas. If you're dealing with having to have electricity payments, that's going to take up. So, and then that money is supposed to also help them with a laptop, with a Wi-Fi or, access. So then we also then found money that we then could look at creating a laptop loaner program, as was I kind of mentioned earlier, things like that to try to meet this need. But what we found out also with all that is that we'd go to places, and like I mentioned earlier, they would not have access. So we'd give them a laptop, we'd give them a Wi-Fi, and there was no access where they lived on the reservation. And then it was trying to figure out, what do we do to help them in those cases? And, we're still trying to find the answers to that.
Thank you. Dr. Proctor, what about you?
So we grappled with the varying guidance that we were getting at the beginning of the CARES Act when it was distributed. And so we finally, once we got the guidance, we thought it was important to get the funds in the students' hands immediately. And so while only 4,400 of our students qualified per the guidance, we thought timing was important because there were still long lines for unemployment and things of that nature. And so we we thought it was important to get the students the funds right away. But to complement that, as I mentioned before, we had some success initiatives already in play. So even with the laptop loaner, we also had graphing calculator loaners in play for our math and science students as well. Our foundation, our community stepped up and raised money. So we had another $300,000 with some matching dollars from the college, and our board of trustees supported that, where we were able to raise those funds as well and complement those who couldn't qualify, right? So we needed to reach as many students as possible with financial support, and that financial support could have been linked to rent, personal supplies, hygiene, food, transportation if they were actually employed, but they needed some help. So the students identified through a form stack process what their needs were, and that gave us a sense, the committee that was making those decisions on what their needs were, and we had set amounts, and those students were issued checks. You know, Dr. Russell brought up the fact that some did not have bank accounts, and so we encountered that very same issue. And so our finance team, instead of just the debit, actually were writing checks. And then we also encountered incorrect addresses in the system. And so, you know, we worked through all of that, but we made sure not only from the CARES Act funding, but also the community and our donors and employees stepped up to really support the students. And then, you know, moving forward, you know, it's not a one and done thing. So we're thinking about how do we provide tuition relief for students? We've waived fees, the distance learning fee. Well, everyone's learning from a distance right now. So $500,000 we've waived in those fees for students not to have to pay that for access to learning. And we're putting in place, starting this fall, some of our academic programs that are high demand, high wage. We want our students to be able to take advantage of that, both short-term certificate training. We put contact tracing in as a program this summer that by the end of the summer, at least 2 groups of students would have gone through those classes and now can actually work with our public health department and you know, get employed that way. So we're trying different ways, again, using the student feedback, knowing what their concerns are, and really working as a community to support them to be successful and complete what they've started with us.
Great, thank you. I'm just gonna remind our listeners that if you have questions for our panel, you can submit them under the question tab on the side of your screen. You can also submit them on social media using hashtag #CommunityCollegesLead. And Chancellor Oakley, I wanted to ask you another thing about the CARES Act is that you actually sued Betsy DeVos for excluding undocumented students from eligibility for those emergency grants. And a judge blocked DeVos's rule in California. And so as I understand it, you've been able to distribute those funds to your students as you see fit. And I'm curious if you could just say very briefly, and I want to be mindful that that we're our time is already drawing short, but can you talk about what difference that's made for your students in California?
Right. So yes, thank you for the question. So first, certainly this impacted directly our undocumented students, which we have well over 70,000 undocumented students in our system, but it also impacted you know, nearly 800,000 students who are non-Title IV eligible. So it's a whole huge community of students that were impacted by the decisions that the department made on the distribution of the CARES Act. It's made a huge difference. These are students who have tremendous needs. They are in some of the most impacted communities in California. So it's made a huge difference. Our colleges have done an outstanding job of getting those resources to the students. It's not enough, but it certainly helps get them, you know, through another few days of this crisis. So, you know, we're hopeful the next stimulus package really focuses attention on our most vulnerable students and funds them fairly.
Thank you. Speaking of the next stimulus package, Chancellor Oakley, I'm going to ask you to address another thing that we're very concerned about right now, which is a kind of a wonky but really important issue of how you count students. So the CARES Act had to have a formula to decide how much colleges are going to get based on the number of students, especially students who receive Pell Grants. That formula that was used for the CARES Act, which is on the table again for the next stimulus, is one that's based on a full-time equivalent count of students. So 2 students studying half-time equal only 1 full-time equivalent student. Community colleges have a lot of part-time students, so this is a concern. So Chancellor Oakley, can you talk about why this issue matters so much for community colleges, and what would you say to the folks who say, well, 4-year institutions with really big residential programs are just more affected by the pandemic, and thus it wouldn't necessarily be bad if they get a larger share of the funding that comes from the next stimulus?
So first of all, I guess the question is, what are we trying to do with the stimulus package? Are we trying to support people? Are we really focused on equity at this moment in time in our nation's history? Because if we are, then we're going to fund a whole student, the needs of a whole student, and the most vulnerable students are in community colleges. If the next stimulus package is to support institutions, well, that's a different conversation. But if we're going to support students and the institutions that serve the needs of those most vulnerable students, then we will fund on headcount, because there is no such thing as part-time need, particularly in this environment. And as you've heard from your panelists, they serve some of the hardest hit communities in America. This is not just an issue of communities of color. This is an issue of all low-income communities, regardless of what the color they are, all across the nation. So I think it's important, if we're real about equity, we're going to fund based on headcount.
Very well said. Thank you so much. Dr. Russell, I wanted to talk about some of the issues that you face in particular running a tribal college. My colleague Vivian Anguiano published a Q&A with you in which you cautioned policymakers against lumping tribal students in with all marginalized students and lumping tribal colleges and universities in with all minority serving institutions. So I'm wondering if you can share a little bit about what policymakers should know about tribal colleges and about your students and your institution.
Well, thank you for the question. I think, it comes down to specifically tribal nations are sovereign nations, and they have an institution that serves their tribe, primarily their tribe. And I think one of the things that is important to understand, let's say take Diné College. It's the oldest and the first tribal college in the country. And it was built primarily in our main campus in 1973. At that time, Congress said you will receive $2 million a year for O&M. We are still waiting for 1 penny. If you were to add that up from the beginning to now, that'd be over 100 million. So when you have the challenges that we're all dealing with, one of the challenges we have is everyone says, well, what you need to do is you need to have, upgrade your HVAC systems, and all of that. For us to do that right now, and we're in the plans to try to have it done, $3 million. $3 million now to address the pandemic, when if we would have been given the money, not just in that college, but all tribal colleges within their Tribal College Act, were also promised that they would have money for operations and maintenance, and never has it ever been given to us. So it's in the language, it's unfunded. So we have to try to then use the money, as Chancellor Oakley mentioned earlier. Is it about students? Is it about facilities? Well, sadly, we have to do both with what little we get. So other policymakers can make the determination, this is for students, this is for institutions. When it comes down to us, we don't have that obligation. We have to look at both of them and say, this is how we're going to do it combined. And I think that's something that's really important. I think the other thing that's important is that if you look at like the Navajo Nation, 30% of the people living on the reservation do not have running water, right? 8.3% of Navajos have a degree of some sort, AA, BA, or certificate. 8.3%. So when I talked about earlier, where do you start when you talk about equity? Where do you start is that you can't lump everybody in, because partly by doing that, you're also then taking away the idea of there are certain needs and responses and promises that were made to tribal nations by the federal government, trust responsibilities, treaty responsibilities that have not been upheld. Those are things that we're still waiting for. A lot of the challenges that we deal with the pandemic, a lot of the challenges that we deal prior to the pandemic, they're rooted in promises not kept. And I think that type of promise and that type of environment is something that needs to be identified. So when you lump everyone together, you take out the individualness of each of those entities. And it's not to say tribal colleges is more important. No, it's to say equally, you know, all areas need to be addressed and need to be addressed individually and then collectively and in terms of funding. So what we're looking at is trying to find a way to make sure that we stop working on the edges. That's the one thing I just want to keep, because that doesn't get us anywhere. And so when we talk about policy changes in Washington, it's really about, okay, how do you really try to make the needle move? And you need to be able to have an understanding of what tribal sovereignty is, what are treaty responsibilities, what are trust responsibilities, in order to address this, you know, and this idea of education equity. But it's also healthcare equity, economic equity. You just start going on down the line until finally, you know, you get to the end of the line.
Thank you so much. Great. Dr. Proctor, you mentioned when we spoke recently that you have seen your students and faculty and staff speaking out about issues of racial justice, equity on campus in the wake of George Floyd's death. So can you talk about what members of your community have been saying and doing and how the college is responding?
Here we go. I was trying to unmute. Yes, throughout this academic year, we've had many conversations, again, prior to the tragedy with George Floyd. And as I mentioned before, we were elevating the conversation around not just diversity and inclusion, but also equity. And I believe it plays a really important role when you use that lens. So our Vice President for Diversity, Equity, and Inclusion had already set up a Lunch and Learn dialogue series in the summer, which happened to fall the week before the tragedy with George Floyd. And so we talked about all kinds of issues, be it equity and equality, what's happening in the classroom, how Yosa's cultural wealth model. Those are some things that we really tried to tackle. And then, of course, after the events with George Floyd, we felt it was important to provide a space for employees just to kind of discuss what they were feeling and process. You know, being remote and scattered, and we talked earlier about mental health, you know, these things are wearing on our community in so many different ways that we wouldn't necessarily get to encounter in a hallway conversation now, right? So providing that space for employees just to kind of talk through what that means and how they're seeing things and what it means to be an ally was a topic of discussion that we put in place so that individuals can understand what that means. And then, of course, our students, as I mentioned earlier this week to you, our Black Student Union showed their own leadership and really elevated their voices and were on social media to talk about their experiences, which of course had us paying attention to in a different way, right? As a result of what was going on around us. And so I personally met with them to hear their stories and also to let them know what we were already focused on as an institution and how we're going to be committed to not just talking about this, but they can see our actions really playing out both in and out of the classroom. And I talk with our faculty. I ask them, what are we going to do in the classroom? What would they do in the classroom to really make sure that we're fostering an inclusive environment? And one of the proposals that they've set forth, and we're taking them up on, is establishing a social justice task force and actually launching that in the fall and really tackling these issues together as a community. And knowing that mistakes will be made, I want to make that clear, because no one is perfect and knows how to address this fully. But I think together, as we understand the nuances and the challenges that we're facing in our college community, with our student body, with our employees, the things that we'll need to do to address that, and bringing experts along the way as well. So those are some things that we're doing, and I'm looking forward to seeing what leadership comes not only from our Student Government Association, I met with them as well, the Black Student Union, but also our faculty and staff. So that just gives you an overview of what we've done.
Thank you. Thank you. And we're going to go to questions from our audience in just a couple of minutes. A related question for you, Chancellor Oakley. You train, or your colleges train, a lot of the police in California. In light of the conversation about police brutality and Black Lives Matter, what are your colleges thinking about changing?
So I think this is true of community colleges across the country. We train, we educate many of the first responders that we see in our community. So we have a direct responsibility at this moment in time to put up a mirror, look at our curriculum, look at the culture that we create in the programs that serve law enforcement, that educate law enforcement, provide professional development for law enforcement, and ensure that we're reflecting the needs of the community in the culture that we're creating. We're community colleges. We need to ensure that we're working hand in hand with our law enforcement brothers and sisters to ensure that we're creating a culture together in our community. And we as colleges, as educators, need to be accountable and responsible for the education that we're providing. And so I think it's a moment in time where we have to take that on directly and question what's going on in our classroom and ask the question, how can we improve the culture and support that we give to law enforcement?
Thank you so much. Great. I have so much more I want to ask, but we also have some great questions from our audience. So I'm going to give them a chance to be heard on a couple of things, and then we'll probably steal back a couple minutes of my own towards the end. So one question that we received is how you're thinking about staff who are not working full time. They might be on contracts, maybe they're adjuncts, and may not have health care, health insurance. How are you thinking about protecting them, and how will they get treated if they get sick? Are there liability issues that you're thinking about? And I will see if Dr. Proctor, do you want to start with that?
Sure. So as I mentioned before, in our messaging and our decision making, safety has been our number one priority. And so if we have employees that are concerned about their health or have health issues, that we're making sure that they want to continue working remotely, right? We have some essential employees that are on campus and doing things that keep operations going in terms of systems, building systems and things of that nature. But when it comes to an employee that may be needed on campus, if they present an issue, a health concern, we're making sure that they're taken care of, and we know we're going to find ways for their supervisors to be flexible for them to work from home. And if they're unable to do that, we certainly have the Families First Act that can give them the appropriate leave, right, aligned to that documented medical circumstance. So again, safety and our health of our employees being number one. And so we're not, childcare is another issue that's surfacing, right? As you think about the K-12 systems pulling back and going fully remote, that is one of the issues that we're grappling with as well, in terms of employees who are working remotely. They may have health concerns. Now they have children at home, and how can they do their jobs? And so these things play out at different levels for different employees. Some may be elderly, some may have older kids at home or younger kids at home. There isn't one solution, but if we're operating with compassion and looking at the safety and health of our employees, I think we'll find the right answer.
Thank you, Dr. Proctor. So I'm going to combine a couple of questions that we've received. We've been asked about what sort of coordinating you might be doing with your local K-12 districts, and we've also been asked about whether these crises present any opportunities to work on transfer success with the four-year institutions you partner with. And Dr. Russell, when we talked the other day, you were touching on this, so I wonder if you could take that.
Yeah, I think one of the things that we're looking at, and one of the things I think you talked about an opportunity. I think one of the things pivoting from this is that we have to start looking at education without boundaries. Too often we have, this is Diné College, this is Arizona State University, and yet our students do not view it as that. They're able to go to each institution. If we get away from that frame of mind, if we get away from saying this is mine and that's yours, we start looking at that student as traveling down a path. And I think if we all have then an opportunity to engage that student. So some of the things that we're looking at right now is creating a learning center. I talked about, we don't have access throughout the reservation. So we've looked at the data and see this is where we have an increased number of students that are coming from this part of the reservation. So maybe we develop a learning center there that then has the access that they can utilize. But it's not just for Diné College students. What about K-12? We have a whole semester of students that have missed out. K-12, they've lost, that opportunity. We have 83% of our students require remedial. That was before this last semester. Now what's that going to do? So they need a way to catch up. So we can combine and say, how can we partner with K-12? How can we partner with even the other institutions? So a lot of our students on the reservation are saying, I don't want to go back to Arizona State University or University of New Mexico. I want to stay home. And so that shouldn't mean they can't continue their education, even if they don't have access. So maybe trying to develop, and we've been talking to some of the universities, of sharing that space and providing that opportunity for those students to be able then to take a class from anywhere. But at the same time, they then can provide tutoring for K-12 to help catch them up. It's not just about the pandemic. K-12 was 2 years behind prior to the pandemic. Now it's 2.5 or more. So how are those Navajo students going to catch up? I think this is something which we need to look at this in its totality and saying the responsibility we have is to educate the whole child from whatever grade level to whatever time they exit. And that's everyone's responsibility, not just Diné College, not just K-12, not just whoever is in that free way of education.
Great. I think we have time for one more question. I would like to ask each of you to address, what do you want to see from the next stimulus that comes out of Congress to support your institutions and your students and the community colleges that are really, as Neera said, the engines of the American dream? And Chancellor Oakley, would you like to start?
Sure. Well, that's a big question. First, what I'd like to see is a true commitment to the most vulnerable students in America, to ensure that they have the opportunity to complete their education, to participate in the economy. I'd also like to see a recognition of the huge impact to working adults who don't have a higher education, and give them the opportunity to upskill or reskill themselves at a community college. And then finally, support for states who have been doing everything they can to support their K-12 education. It is vitally important for us in higher education that we ensure that the K-12 systems in our country are well funded, because that's our future. And so I'd like to see a recognition of those three things in the next stimulus.
Thank you. Dr. Proctor?
So I want to reemphasize our current fight with headcount versus FTE. I love the way you put it, Chancellor Oakley. People, right? How are the people? There's no such thing as part-time issues there. It's what the individual is experiencing. We need that kind of support. Community colleges educating almost half of the undergraduates in the country, being economic engines. Really, the level of support that we had when the tech grants were issued. I think that kind of support at the community college level, recognizing we often play a critical role in retooling our nation's workers. And so from an economic development standpoint, not forgetting that we can actually be very nimble and reach many and really uplift those that are often underserved, disadvantaged, and really transform our country, not only locally with our communities, but this is really a matter of global competitiveness. And, we've seen some changes in that regard, even with the recent data in terms of our gross domestic product. It's that we can play a role there. And I'm hoping that the next stimulus package really recognizes that community college is a part of the solution.
Great. Dr. Russell, last word to you.
Yeah, I think what I would look at is a lot of when we talk about funding for higher ed, it's about attending college. We got to go beyond just that. That's too low of a threshold that they attend college. It's about the success they have, and it's about how we then can build those programs that meet those needs. So in tribal colleges with TCUs, one of the missions that every single college has is about nation building. It's about how do you help rebuild not just the United States, but more directly tribal nations. It's about building their capacity. And so looking at the next CARES Act to be able to say, this is more than just about education. It goes a lot further than that. And when I talked about earlier the lack of O&M and things like that, we need an influx in tribal colleges. We need a lot of money, to be blunt, that would help bring us up to par. Technology needs right now. We don't have, we have right now, across the board, all of our TCUs are just poorly equipped with broadband access. That is more than what this previous CARES Act would do. But at the same time, we need to then build the capacity of the institutions. A lot of these were built in shared buildings. They're old buildings, they're dilapidated buildings, and there was a promise met. So what I'd like to see in the next CARES Act is a promise kept.
That is a beautiful note to end on. There is a promise to tribal nations. There is a promise to all the people of the United States that they have the opportunity to have good lives and to contribute to their country. And you all are at the forefront of making that possible. And thank you so much for your advocacy for these issues that we all care about so much, and for voicing the needs of your students and the resilience of your institutions. It was really great to be with you. Chancellor Oakley, Dr. Proctor, Dr. Russell, thank you all so much. And to our audience as well, thank you for joining us. It's been a really great conversation. Bye, everyone.